They said they want an independent survey. So we had an independent survey. It was conducted in 2021 during the pandemic. The overall objective of the research is to undertake a national survey of consumers and retailers of alcohol, beverages, and wines to determine the extent of alcohol abuse among underage. A total of about 2,000 were used from 6 geopolitical zones. And the result was damning. The result was damning to this country. Why? Because it was found out that 54.3% of minors and underage obtain alcohol by themselves from various sources. 49.9% of them patronize retailers of drinks sold in sachet packs and PET bottles. 50% of our children drink alcohol. Findings further suggest that minors and underage also access alcoholic drinks from friends and relatives, about 50% also, as well as from social gatherings. Of those who procure drinks for themselves, 47.2% of minors and 48.8% of underage procure drinks in sachets because it is easy to consume. Whether you are good parents or not good, bad, or you are a bad parent, doesn't really matter. These sachets are easy to consume, and that is what NAFDAC has banned. Packet sizes that are small, that children can consume. Frequency of alcohol consumption by minors and underage. The survey data revealed that 63.2% of minors and 54% of underage drink alcohol occasionally, while 44.3% and 38.3% of adults drink alcohol occasionally and daily respectively. So they even drink it more than adults because it is easy to consume. Additionally, 9.3% of minors and 25.2% of underage children consume alcoholic beverages, and 11.3% of minors and 9.4% of underage consume alcohol at least once a week. As young as 9 years old, in this survey, consume alcohol. Most minors underage, summary of findings, buy alcohol for themselves. It's about 50 naira to buy sachet alcohol. Some people have been rich, have been made rich, but some children are losing their future, their livelihoods in the future. Some children are potential patients for liver cirrhosis, for kidney failure, for mental instability. The pattern of alcohol consumption and abuse by minors and underage. The survey findings revealed that about 11.7% of underage children have ever engaged in binge drinking. This is mostly reported in Gombe, 16.3%, FCT 15%, Anambra 11.4%. In terms of the most use of alcohol, it is Lagos State and Rivers. What is the impact on health? Why are we so concerned in NAFDAC? Because our mandate is to ensure that we protect the health of our people, including children. Impact on health, brain development. Alcohol can damage the hippocampus, memory center in the brain, and prefrontal cortex, leading to permanent issues with learning, memory, and impulse control. I took this from the internet. Immediate dangers: binge drinking, is common, risking alcohol poisoning, which can cause fatal shutdowns of breathing and heart rate. Physical health. Underage drinking is linked to liver and kidney damage, hypertension, disrupted hormone growth, and increased cancer risk later in life. Mental health. It increases risk of depression, anxiety, and low self-esteem. Addiction. Alcohol is an addictive substance. Youth who begin drinking before age 15, the minors and underage in our study, are 41% more likely to become dependent on alcohol, and this study also shows that they graduate to start taking cocaine and other narcotics. Behavioral consequences. Violence is a major factor. Alcohol drinking in youth, major factor in youth suicides, homicides, and motor vehicle crashes or accidents. Risky behavior is strongly linked to unprotected sexual activity, unwanted pregnancies, and sexually transmitted diseases. Academic problems. Drinking often leads to lower grades, missed classes, and impaired cognitive function. In our country, it is responsible for banditry. It is responsible for kidnapping. You cannot be in your right mind and point a gun at somebody. It starts from alcohol and then goes on to hard drugs. Because of all this, the Senate decided that they're going to make resolutions. On November 6, 2025, they made the resolutions, and these were communicated to the Secretary to the Federal Government, SGF, on December 1, 2025. And the resolutions urge NAFDAC not to grant further extension to the moratorium and to ensure immediate strict enforcement of the ban on sachet alcohol and alcohol in small bottles. It urges the Federal Ministry of Health and Social Welfare to support NAFDAC on the ban on sachet alcohol and alcohol in smaller bottles. It urges Federal Ministry of Health to release its national alcohol policy that includes prohibition of alcohol in sachets and small bottles less than 200 ml. It urges National Orientation Agency and NAFDAC to collaborate and intensify nationwide sensitization of dangers of alcohol in sachets and small bottle bottles. In conclusion, access to alcohol by children can be limited if the pack sizes, sachets, and small bottle bottles that can be easily concealed are made not available, and that ban is going to ensure that. Or this ban is going to ensure that. Ban on small pack sizes can reduce the menace of underage drinking. Consumption of alcohol should raise alarm for parents, teachers, religious leaders, and community at large. NAFDAC and National Orientation Agency are collaborating to significantly increase the awareness and sensitization. Thank you very much, and God bless you.